Turning to tonight's health spotlight, counterfeit drug overdoses and deaths have reached a record high.
I want to bring in Wish TV's medical reporter, Dr. Mary Gillis, who explains what's driving this epidemic. Mary.
Well, Alexis, Phil, the CDC reports more than 100,000 people died of a drug overdose last year, the highest number ever recorded in the U.S. The agency also blames fentanyl, a common ingredient in counterfeit pills, as the primary reason for the surge in deaths. And they warn the situation is only going to worsen. I spoke with Shabir Sevdar, executive director of the Partnership for Safe Medicines, who tells me what's catapulting this public health crisis ravaging our country.
Recently, we've seen drug traffickers selling counterfeit pills move onto social media because there's very little accountability and they can operate there with relative impunity. The worst thing that happens is they get removed from the platform, but even that doesn't happen very often. And with that, we've seen fatalities trend younger and younger because these drug traffickers now have access to younger people using social media.
Savdar says these pills are getting into the hands of kids as young as 12 years old. He lists several things that need to be done individually and on a public policy level to stop the epidemic. First, talk to your family about the risks of taking pills that are not prescribed by a doctor. He urges policymakers to support law enforcement by giving them every investigative tool they need. Talk to your legislative officials about ways to solve the problem. By this, Savdar means having a voice discouraging the purchase of drugs from overseas. Even though they may be cheaper, he says it should not be at the expense of our nation's safety. Reporting from the studio, I'm Wish TV's medical reporter, Dr. Mary Gillis.